our country, South Africa, does not have an effective coordinated response to the scourge of gender-based violence. This failure to implement our laws and policies effectively is doing a complete disservice to the survivors of gender-based violence and others affected by violence.
In November 2018, President Cyril Ramaphosa announced a national action plan that would drive crucial resources to stakeholders at the forefront of addressing gender-based violence. But the roadmap has been stalled. The promised vehicles have not been steered in the direction of the sector that needs them most.
Shelters are desperate, and these are people that are working behind the scenes to kind of uphold the services that exist.
This money must find a way to those NGOs.
I believe that there's very much some fishy business happening. We have to expose these people.
Tonight, Special Assignment investigates the detours on a road that threatens to go nowhere slowly.
I want to start off by saying that we need to unite the voices of the women in South Africa.
Another Women's Month, another cry for action. For years, the protests, the demonstrations, the marches and the memorandums. Again, no cause for celebration as the violation of women and children continues. At least 26 women and children murdered in this Women's Month alone, and that's not counting the unreported cases of victims abducted, trafficked, raped, and re-victimized.
This morning, we choose not to celebrate Women's Day because we have nothing to celebrate in a country where we, the women, are unsafe. In a country where gender-based violence is the national sports. And we believe the victims that are still out there that are afraid. This message is for you on this Women's Day. So we believe you. And we also want to say to the perpetrator out there, we see you.
Despite the message resonating across the generations, the crisis of gender-based violence is now described as South Africa's secondary pandemic. But the number of victims would be much higher were it not for the crucial intervention of shelters for survivors of domestic abuse and violence.
Shelters always play an absolutely critical role in saving women's lives. They tend to intervene at a point of crisis in the lives of women. They then support women and then continue to provide the tools which will help to empower women to be able to live fuller lives.
Sheltering work is very much of restoring human dignity and self-worth.
Yes.
To say that you can
Yes.
and you will, because you are worth it and worthy of it. And I think that is because you believe in the work that you're doing, and no amount of money can compensate that feeling that you feel in terms of upliftment. When you know emphatically that you have changed the life course of someone.
Joy Langer is the head of the Women's Shelter Movement in the Western Cape, and she runs St. Anne's Shelter for women survivors of abuse and their children. First established in 1904, it is the oldest women's shelter in South Africa, and yet now its future is in jeopardy.
With COVID, things have just been amplified. And now that I looked at our financial accounts this morning, and I was saying to myself, oh my word, we need to do something, because it looks like within 3 months or so, we're not going to have any funding in our accounts.
It costs St Anne's almost 4 million rand per year to provide quality support and empowerment programs.
Government gives us 40% of our annual budget. And so the rest we have to find. And so it's a constant slog.
The National Department of Social Development disperses its annual budget to each of the provinces, but it is up to the provincial departments to disperse the funding for women's shelters. In some provinces, women's shelters are barely fit for human occupation.
In Mpumalanga, there's a shelter that is utilized from a shipping container. Now, the problem with that is it is freezing cold in the winter in a shipping container.
The allocations that gets given to the provinces, they then disperse of the funds the way they see fit for the need of their province. But what this means is that it's actually in violation of the Constitution. So I don't see why it is that within one province we could get 71 rand per day, for example, within the Western Cape, whereas within the Free State, it's 9 rand per person. That's the allocation that gets given.
In some provinces of the country, such as the Eastern Cape and the Northwest Province, the shelters haven't been paid their funding for the whole 2020-21 year. But the question becomes, what do they do and what are they expected to do?
Zubeida Dangor heads the National Shelter Movement of South Africa. For decades, the NSM has been lobbying government to improve service delivery and increase its funding of shelters. An investigation conducted by the Commission for Gender Equality into the state of shelters in South Africa has exposed the appalling situation in some provinces and the systemic failure of government to respect the rights of abused women and provide equitable access to safety and service delivery.
The CGE, like the NSM, has found through their research that shelters are underfunded, and this is critical. But at the same time, on the 24th of August, Minister Zulu said to the ENCA station that shelters are adequately funded. So there's this contradiction that occurs between what the minister believes and what we're saying is happening on the ground.
The Department of Social Development has not responded to Special Assignment's repeated requests for an interview. So let's compare the price the state pays per day for women in shelters, 71 rand per day in the Western Cape or 9 rand in the Free State, to the amount taxpayers fork out to subsidise an inmate per day, almost 400 rand. Simply and grimly put, a criminal who rapes and murders is offered a better quality of life and protection inside prison than his victims seeking shelter and safety on the outside.
This is unacceptable. What about the human rights of those women? They already are vulnerable. And what are we doing in re-victimizing them?
In September 2018, together with thousands of South Africans and civil society organizations, the Total Shutdown Movement, a broad-based movement formed through social media, embarked on countrywide protests against gender-based violence.
One of the 24 demands of the Total Shutdown was a gender summit must be held, which was held in November 2018. Out of that summit, one of the resolutions of the summit was a declaration that ordered the establishment of an interim steering committee, representative of civil society and government.
Brenda Madumise Pajibo is a legal advocate who, together with presidential advisor Professor Olive Shisana, co-chaired the broad-based interim steering committee. So let's try to navigate our way through this roadmap. In the wake of the Total Shutdown protests and the GBV summit, The Interim Steering Committee was mandated to set up a permanent GBV council that would report to the President. But the Steering Committee also developed an emergency response action plan and, most importantly, a national strategic plan that would be implemented and monitored by this permanent national GBV council.
Which is the work that we did from that January 2019 until we handed it over to government in October 2019, right? And then government had to do their own internal processes.
One of the leaders of the total shutdown movement, Madumise Pajibo, insists she's focused primarily on combating gender-based violence, and towards this end, she has established an organization called Wise for Africa.
So Wise came out of some members who were part of driving the total shutdown, deciding to have a different focus. And the focus really is around lobbying and advocacy.
Although she has had an internationally acclaimed career in the health sector, including heading the Human Sciences Research Council and winning numerous awards, co-chairperson of the Interim Steering Committee and presidential advisor, Professor Olive Shisana's journey prior to GBV has not been controversy-free. As Director General of Health in 1996, she was implicated in the Sarafina funding scandal. But her high profile on the global health stage has helped her wield enormous power. Professor Shisana declined to be interviewed for this story. Also on the Interim Steering Committee was Zubeida Dango, head of the National Women's Shelter Movement.
The Interim Steering Committee did meet its obligations. I think we were set up to ensure that the National Strategic Plan for Gender-Based Violence was completed, and that was clearly done with consultation in all 9 provinces. The Rapid Response Project was activated, and then of course the structure for the GBV Council was set up.
The Interim Steering Committee was disbanded at the end of April and replaced by an interministerial committee from different government departments that would supposedly continue with the process of establishing the Permanent National Council on Gender-Based Violence.
I feel that the President disbanded the committee prematurely before the Gender-Based Violence Committee, the more permanent committee, was actually put in place. And I feel that that has left kind of gaps.
It was overseen by the Department of Women, Youth and Persons with Disabilities. But to date, the Permanent National Council on GBV has not yet been formed. So what exactly is the National Strategic Plan? The 132-page document focuses on developing policies, strategies, solutions and funding to combat GBV and femicide over the next 5 years. The 6-pillar plan involves multiple sectors. Crucially, the 4th pillar focuses on steering critical resources to the NGO sector, including underfunded women's shelters. But it would cost about 8 billion rand to implement this 5-year plan.
We now have the NSP, the National Strategic Plan, which is a very important document. The test then is, are you going to be able to fund that document?
Unfortunately, lack of funding and capacity characterized a previous National Strategic Plan and National Council on GBV formulated during the Zuma era. After almost 2 years of going nowhere slowly, they were both disbanded by then Minister of Women, Susan Shabangu.
I hope we are not reinventing the wheel. I hope we are not again creating another structure that we will not be able to fund, will not be able to ensure that we monitor its efficacy.
Mbuyisela Botha is a veteran gender rights activist and a member of the Commission on Gender Equality, a Chapter 9 institution set up constitutionally to monitor, oversee and investigate the sector, but it is also severely under-resourced.
We have established these institutions because we want to feel good, we want to be seen to do good, but when it comes to, when the rubber hits the tarmac, then we are left wanting.
But there is mass confusion and disturbing questions being asked about a gender-based violence and femicide fund that was announced by President Ramaphosa in November 2019 in response to the national outcry over gender-based violence that nearly brought the entire country to a halt. The 1.6 billion rand would be reprioritized from different government departments towards tackling gender-based violence on a multi-sectoral basis.
Out of that 1.6 billion then, there was a decision to allocate 130 million to civil society organization, right? And that money was going to be coming from Department of Health, Department of Social Development, and the bulk of it was really coming out of Department of Social Development. Right?
Civil society are getting money from the National Development Agency. There was an advert that came out nationally for everyone to apply. And when they applied, we had more than 116 applications. NDA is in the process of reviewing those, and hopefully they'll be able to come back to people as to who gets funded, because there's criteria for how you get funded. It's not just money that's just being dished out.
But the National Department of Social Development could only contribute 50 million rand from its budget. So 100 million rand was apparently taken from the Criminal Assets Recovery, or CARA funds. This money would be allocated to civil society through the Department of Social Development's National Development Agency to hundreds of NGOs supporting victims of GBV, including shelters.
And we were told that the funding was going to be allocated in March already, and we are now in September.
Shelters are desperate, and these are people that are working behind the scenes to kind of uphold the services that exist. And I think that they really do deserve to be supported. And so in the absence of that, and in the absence of the tiniest payments of funding, there seems to be a lack of commitment.
Drivers of change. This was the message and literally the medium in February this year, when 5 electric BMWs worth millions were donated to provide transport for NGOs at the forefront of combating gender-based violence. The donation was part of the Car Industry Transformative Fund. The handover was accompanied by media fanfare and even attended by German Chancellor Angela Merkel.
This is an effort for us to have cars in the entire 44 districts across the country, where those people that are going to be doing house-to-house interventions or community interventions have transport.
But here the details become murky. The cars were received by the GBV Summit Interim Steering Committee and handed for safekeeping to an entity called the South African Business Coalition on Health and AIDS, or SABCOA. This entity was supposedly going to administer the GBV fund on behalf of the private sector.
So I would like to thank the South African Business Coalition on HIV and AIDS for their assistance in raising the funding for gender-based violence.
But there has been no private sector GBV funding from or through SABCOA, and allegedly no consultation on its appointment.
It was a fait accompli. We were basically told that SABCOA would be, the partner that would be in charge of the GBV funds, but that they would also be holding the BMWs that were donated by the German government until the committee, the final committee was set in place. Now, that was the last that we've actually heard from it.
During November, correspondence between Presidential Advisor and Co-Chairperson of the Interim Steering Committee, Professor Shisana, and SABCOA, as well as certain members of the Steering Committee, suggest that SABCOA was chosen without following normal tender procedures. This was a concern raised in the emails.
SABCOA wrote to the President to say, here we are available. This is the work that we do. we would like to mobilize private sector funding to support GBV. That's where they were coming from.
But why was this particular entity chosen to administer such a crucial fund, especially as it had no involvement with the GBV sector? Established in 2001, SABCOA markets itself as a broad coalition of privately owned businesses involved with HIV/AIDS. Its website contains no programs related to GBV, only HIV/AIDS prevention.
We weren't given that much of opportunity between, different parties to be able to make a decision. And that, for me, is a problem.
SABCOA CEO Siyabonga Jikwana declined to be interviewed, stating that COVID had derailed SABCOA's plans to administer the GBV funds, but that he was hoping to re-engage with government in the near future.
Nothing happened. So we have not mobilized the funding as yet. So SABCOA that was willing to assist with mobilization of this private sector funding, that has fallen flat.
But what about the cars? After their official handover to SABCOA in February, there has been confusion about their precise location, and several NGOs allege that they have been clocking up mileage by drivers other than their intended beneficiaries. So in early August, Special Assignment started inquiring about the cars, even visiting SABCOA's current premises. They weren't there.
So those cars are sitting there, if they're still there, and in this time of COVID, they could have been utilized.
So those cars SABCOA has handed them over.
To whom?
To the Department of Women.
When did they hand them over? Do you know more or less?
If I'm not mistaken, it's a couple of weeks now.
Coincidentally, perhaps, the reported handover to the Department of Women, Youth and Persons with Disabilities occurred soon after Special Assignment started inquiring about their location. The Department of Women has ignored Special Assignment's requests for interviews, but we managed to track the address where the cars are supposedly being held now. Right to Care is an internationally linked healthcare organization also involved with HIV and AIDS. Apparently, it is the private sector entity that will partner with the presidency to steer the National Strategic Plan and finally drive the elusive GBV fund. To date, have any private sector funds even been raised for the GBV fund?
There's been no consultation on it. So there are concerns around that.
In a letter, Right to Care states that the BMWs were delivered at the end of August to be placed for asset management with Right to Care, while the district managers that will use these vehicles for outreach activities are being hired by the presidency. But do these district managers include the struggling NGOs on the ground who are supposed to be the beneficiaries of these vehicles? If so, to whom will they be allocated and when? We visited the company to get physical proof that the entire fleet was actually there, but were told that we first needed permission from the Director General of the Department of Women. At the time of broadcast, we had not received a response to our request for visual proof. On the 24th of August of this year, the National Shelter Movement wrote an open letter to the presidency, again highlighting their funding crisis at a time when their services are needed more than ever. They are still awaiting a response.
The work that the shelter movement in the country are doing, should actually ordinarily be done by government. I mean, government as a duty bearer have a responsibility to protect its citizens, has a responsibility to create conditions that are conducive for non-violence. So when you have shelters in our country that would always have to go with a begging bowl, it's an indictment on all of us.